Hello viewers, welcome to my YouTube channel, and I am glad to welcome you all. And please don't forget to subscribe to my channel. My name is Sister Dr. Juliet Wambui Macharia, and I belong to the congregation of Sisters of St. Joseph of Mombasa. Currently, I'm based in Voi, working at Moi County Referral Hospital, and I am a fertility educator and medical management doctor, helping women regain back their fertility, and especially those who have suffered for many years without children. FEM, that is Fertility Education and Medical Management, has an answer for you. So do not trouble yourself so much. Visit us, come see us, and we will help you to regain back your fertility, and therefore you are able to conceive. For those women with menstrual disorders, young girls who have heavy bleeding and some gynecological issues, please come see us and we'll be helpful to you. So today I want to talk about preparation of surgery. I believe and understand that surgery is one of the management that a doctor or a specialist might or will tend to tell a patient if there is a need for that. When we talk of surgery, is that you may be needed or you will be taken to theater therefore, and some surgery will take place. So you'll undergo anesthesia, that is either spinal or a general. It depends with your condition. But how prepared are we to face the surgery? And most of the patients undergo surgery without even understanding why they are being taken there. So today I just want to take you through the preparation of surgeries. I believe we have surgeries which are emergencies. So in that case, the doctor has to take his or her time. If the patient is not in a stable condition to understand, but there are relatives or a kin, somebody who is closely to this patient, needs to know why my patient is being taken for surgery. So surgery is not just a simple thing as people may think. And anyone who goes in as a medical practitioner must have been accredited by, if it is in our country, we have the KMPDC to do such surgeries. Because it is not just a surgery. It is something that requires whoever is doing, that is a surgeon, whether a general surgeon or any medical officer, needs to understand what actually he or she is going to do to this patient, or what type of surgery is going to be carried on. But I've come across majority of our patients who have undergone surgeries, but they don't even know why they went for surgery. They don't know. They'll tell you, my doctor told me that I have to go to theater to be operated. Then what was the diagnosis, or what was that which made you go, or which made the doctor plus you to make that conclusion now that we are going to do an operation? So it's just my request that as you watch this channel, whether you were once whether you once underwent a surgery, or maybe a friend of you underwent this surgery, it is always important before you get into theater to know the reason behind. And this is our work as medical officers, our work as specialists, to help the patients understand why we are taking them to theater. What is the diagnosis behind him may not understand it in our medical terms, but we can help them together with a close relative understand in that simple language why we are taking them to theater, such that even after surgery, the patient can tell or can narrate that this is what happened to me, and because of this condition, the doctor requested me that he's going to take me to theater. And after explaining to me, then I agreed, and this is what happened. And after surgery, the doctor need to explain to the patient what you call the intra-op, or what were the findings of what he operated. We need to talk to our patients, my dear ones. Sometimes we take them for granted, and I think it's not ethical. We need to tell them why we are taking them. What is the reason behind? In just very simple manner. And if you know that the patient is afraid and this surgery is important, we have close relatives. Talk to them. Educate them. Let them understand. And this now comes the issue of consent. When you talk of the word consent, it's not only signing. It is not only for this patient just to read few words in that paper and then he or she signs. It is not that way. Sit with the patients, and especially those who have planned elective, even the emergencies. However short time you may use, they may not understand it that deeply for that particular time. But try to explain to this patient, why are you taking this? So the patient has to accept after understanding. And he or she will accept willingly if you have tried to take your time to educate this patient. But most of the time, we just bring on the concept and then we sign. Now, to all those who are viewing me, don't be a victim of this. Understand that is the role of any medical practitioner who is preparing this patient for an operation. We need to sit down with this patient, explain in detailed manner why we are taking this patient to theater. And after telling them the pros and cons of this surgery, then the patient willingly accept. After accepting, and even if there is any close relative nearby, then the patient willingly, not forcingly, no, he just willingly took that piece of paper or form and fills, puts a signature, reads the words, understands and fills. And sometimes they are very busy, they are very fast, yeah? They just sign. And we even tell them, just sign here. Sign here, we don't have time, just sign. Poor patient just goes in without that deep understanding of what is going on. Even if it is an emergency, we work as a team. The doctor needs to explain to the relatives, I'm taking this patient in because of excessive bleeding. We need to stop this bleeding, and I cannot stop it this way. I need to go for an operation. This mother is pregnant. She has come bleeding. The status of the baby is not okay. We need to go in and deliver this baby as fast as we can before this patient or this baby dies. And after explaining simple words, the patient will agree. Then bring the consent form. Let the patient read or read for the patient. And then let the patient sign. And when you sign, then take this patient to theater. So, apart from other preparation, I think this is the most important part. Educating this patient and letting the patient give out his or her consent without forcing her or him, and after understanding. Even ask them, do they have any questions? Or are they comfortable? Sometimes I ask my patients, are you comfortable with me operating? Because maybe the way I look, they might not be that comfortable. If they say no, I may look for another patient, for another doctor. The patient has a right, and we need to help them understand what we know. Let us take time, my dear colleagues, especially this particular moment when we are preparing our patient to go to theater. Most of us, we need this patient pay, we need you to pay, we need to have insurance and all that. That is good. But does the patient understand? So that is one. Two, for all the patients, I've said that you need to understand why you are going to theater. But I also want to warn you that understand or know your doctor. Know your doctor. There are so many doctors outside there, but some are not the true doctors. So know your doctor. Know your doctor well. Number 3, as we have started seeing so many operations being done, but do you really need sometimes to take patient to theater because of some conditions which sometimes they can just resolve on their own? A good example which sometimes makes me mad is taking a patient in because especially she, let me talk of she, because she has what you call a simple cyst, a simple ovarian cyst. We normally have cysts. A cyst is you can talk about, it's a pocket of fluid inside. And any woman can have a cyst, and especially after ovulation, we can normally have a cyst. Pregnant women can have cysts, which they need not to be removed. So if a radiographer tells me that this is a simple cyst, why disturb the psychology of this patient? A simple cyst will go away on its own time. Just counsel the patient, let her understand. It is simple. It's not complex. It's just simple cyst. So if it is simple cyst, as a gynecologist, we don't worry much about simple cyst. We just follow up the patient. If it persists, it's painful, and other complication comes in, that's when we can take this patient to theater. But you don't need to operate a simple cyst. So for those who like taking their time, telling them, this is a cyst, it needs to be removed, we need to plan you for surgery. No, please. Surgery is not just a simple thing as many people may think. It's not simple. The moment you put your knife in somebody's body, that is a scar for life. Remember that? So why? A woman comes in bleeding. And these are one of the most common reasons why women visit us at the gynecological clinics. So she comes bleeding. She has bled maybe twice or thrice. And the bleeding is heavy. And it has persisted. She has irregular cycles. And this woman, because of what she normally undergoes, she doesn't want. She said, you give her different option. And one of the options is we remove that uterus. Let's remove the uterus. It's the only organ which is making you bleed. So once we remove the uterus, then you are fine. And the woman is happy. She's happy because she doesn't want to suffer from this bleeding. She doesn't want to see herself changing kind of pads now and then. No, it's disturbing. So, yeah, okay, doctor, if you want to take out my uterus, I'm okay. I'm comfortable. Take it out. And she's planned for surgery. A major surgery, that is the removal of the uterus. And sometimes plus the cervix, what we call total abdominal hysterectomy. This is a woman of around 6 years. But what was the main cause of bleeding before taking her out? So, bleeding is just a symptom. It's there to tell you things are not okay. It is not there to tell you, can you go and take the uterus out? That is what I'm always mad with. Uterus is a very important organ to any woman in this planet, just as ovaries. Now, why do we take this patient? Because they have excessive bleeding. Why? Do you know that if this woman has high levels of prolactin hormone, this could make her bleed excessively? If she has hyperthyroidism, that is excessive thyroid hormone, she can also have excessive bleeding. And sometimes we have patients who present to us with these two hormones, all of them are high. Prolactin levels is high, thyroid hormone is high. So these two hormones are very important. So if we just go in without checking these hormones plus other hormones, without thinking twice, the only thing you think of it is just taking the uterus out, then you are not helping this client, because we will remove the uterus, but will not have treated the hyperprolactinemia in this patient or the hyperthyroidism in this patient. Instead, we have removed her precious uterus, but the condition still remains in her body. This young lady is overweight. She is around 28 years and her body weight is 92. So she's obese. And maybe we can classify her at obesity class maybe 2 or 3, depending on her height. Obesity, high BMI levels, which can lead to hyperinsulinemia in this lady, can make a woman bleed, have excessive bleeding. So we are busy removing the uterus, but we are not treating the underlying cause of which makes this uterus bleed like hell. So we stop the bleeding, but the condition still remains. So we have not done anything. We have patients who present with multiple cysts. They have cysts around their ovaries. So if it's one huge complex cyst with some radiological changes, that is allowed. But if this patient has a small cyst, think twice. Is she overweight? How is the estrogen levels in her body? And we don't just check the estrogen levels anyhow. You must understand when you have to check the estrogen levels. You cannot check estrogen levels on day 12 and it's quite high. and then you say this woman is normal. It has a specific date on when to check. So if you get to know the levels, the basic hormonal levels in this patient, you'll not be worried about the cyst. You'll not be worried. So we don't need to go and remove them. Treat what she's suffering from. Treat the problem. So these are conditions of women which sometimes medical practitioners, we try to rush them to theater, giving these women scars, pain, and sometimes side effects of the surgery which can last for long, for nothing. It's for nothing. So take time. If you don't understand the real diagnosis, refer this patient. There's no harm. Don't go in and do funny things to our dear clients, and then you think you are happy, yet you have done what is not supposed to do. So that is, we have talked about, we are just continuing the preparation of surgeries and what patients need to understand when they are planned for the operations. You may also be suffering from other conditions. For example, people who present with a lot of bloating, then a lot of acid, hyperacidity. They always have complain of discomfort, abdominal discomfort, and they have been visiting outpatient clinic often, and every time they are being informed that they have peptic ulcer disease, or sometimes they have gastritis and all this. And then before you plan to go and open up the abdomen, sometimes people do that. Why don't we just check? We use what we call the OGD. Let's check what is here. And I think it's not that expensive, and it is affordable. We're able to check what is eating this patient up. If it's a gastritis, we don't need to open it up. If it's an ulcer, which is ulcerating, or we see there are some complications, then we have a reason for that. But we still have the gastroenterologist who can even manage this patient well. So what I'm trying to talk about is, let us help the patient understand his or her condition of to why we are taking this patient to theater. So preparation and proper understanding the reason behind, then that's the right way to go. We have some cases which are just obvious. Somebody has been involved in an accident, he or she is bleeding. There's a need to take this patient to theater, go and stop the bleeding and repair wherever that is open. The patient can understand. But when it comes to now issues of let's talk of lumps, or we use the term mass or tumors. This is an kind of a mass. In Swahili they call uvimbe. So anything swollen in your body, whether just within the skin, is not inside the muscles, or it is inside your body affecting some of your organs. For example, fibroids, that's a very common when it comes to gynecological surgeries. Myomectomy, removal of those fibroids is a very common thing. So you get you come to the doctor, and then you are told that you have a mass. Try to understand what type of a mass is this doctor talking about. So any mass whereby the feeling it is soft, it is round, yeah, the mass is soft, yeah, then it's round, it is movable, get, and then it is not fixed. That's why it is movable. That means it's not fixed. Yeah, sometimes some radiological can tell you it has got just fluid. So it is now, depending on how big it is, the surgeon can ask you, we go in and remove it, but it seems it's not a bad thing. But before going to the surgery, it is always good to do a CT scan, which can tell us more. To some of the patients, when we ask you for CT scans, like, it's too expensive. Well, yeah, it is expensive, I agree, but it is not expensive as you are. 5,000 and you. A CT scan is important both for you and for the doctor, because it helps me to know more about this mass which is inside your body. It also prepares me psychologically how I'm going to tackle this problem. So it is not a wastage of time. It is a basic need if required before surgery. That is one. Then we have a mass which will present as hard mass. Yeah, in Swahili we say ni ngumu. You feel it's hard, and then it is not movable. It is fixed. So you try to move it, it's not moving. It's hard. Yeah. When you do an ultrasound, it says the edges are rugged. It's not kind of a roundish or oval thing. The margins are not regular. Then you start questioning, what kind of a mass am I going to find more? Am I going to meet with inside this patient's body? Yeah. So in that case, the doctor will also ask you for the preparation of surgery. If it is needed, in this case, we need to do a CT scan. Please do. Please do. Please do. It is very important. The doctor is also preparing herself to make sure when she or he goes in, opens up, open if it's inside the abdomen, wherever it is, then if it's the other way around, it is not benign, it is not a simple, is a complicated, or it is malignant, that means it might be cancerous, then we need to prepare. So CT scan, sometimes depending on where it is, you may be required to do this preparation or imaging preparation so that it helps you together with the doctor. That is one. But again, I've talked about fibroid. Before I finish, I want to talk something about fibroids. Not all fibroids need to be removed, my dear people. Just like the ovarian cysts. A fibroid of 2 centimeters, 3 centimeters, 5 centimeters, which is even outside the uterus. It is just attached, what you call pendulous. It is just hanging. And then, for example, this woman has been suffering from infertility. And then she's told, you are not conceiving because you have this fibroid. This fibroid is making you not to conceive. I disagree totally. A small fibroid, which is even outside, it is not within the endometrium or what you call submucous, just near the endometrium. It does not have any pressure effect to the endometrium. Will not stop woman from conceiving. Unless, if she's not conceiving, it's not because of this fibroid. It is because she has other issues apart from the fibroids. So we need to understand this So women have been taken for surgery for no reasons. A woman with one previous scar, no, not one previous, she has a scar already. When you ask her, she tells, myomectomy was done. How many myomas or fibroids were removed? You see, they were just 2 small ones. Where were they? You see, they told me they were just outside. Why did we go in? Was it necessary for you to do that? Was it necessary? I disagree with it in totality. Unless the fibroid is affecting the inner layer or it has got some pressure. So sometimes you find this woman has multiple fibroids such that the uterus is now bulky enough. The endometrium has been pressurized inside. This woman cannot conceive. But this time I'm talking of these small fibroids, 3-5 centimeters, some outside the uterus, and then you still go in, sometimes even take away the uterus. So my dear people, understand why you are taken in. Going to theater is not as easy as people think. It's not an enjoyable thing. It becomes enjoyable when a woman with 2 previous scars or a woman who had a non-reassuring fetal status, the baby was not in good status, and we rushed her, and the baby is out. Both of us, the mother is happy, the doctor is happy, the whole team is happy because we have saved this baby. It becomes joyous. We have a patient who has got intestinal obstruction. The intestine has rolled themselves. They have obstructed. This patient is suffering from distended abdomen, has not defecated for the past maybe 1 week, and now we need to go in and save him because he's in bad condition. Then you go in, the surgery is successful, and this patient now is back to, is more stable than he was, and he's able now even to perform the activities. That's when the joy comes in, because surgery is part of the management. But here we are talking of unnecessary surgeries. That's why I am pushing to all patients, or even those who are viewing me, understand why you are being taken for surgery. And I'm basing more in gynecological issues because that's my field. Now, a young lady of 30 years, 35 years, even 40, who has got some issues with her ovaries. Yeah, she may present with maybe persistent cyst, which keeps on coming and going. Yeah, and sometimes when you remove, if we don't remove the capsules, they tend to recur. Yeah, and the patient's tired and tells you, "Can you please get out my ovaries?" She's 36. She's 30. That's less than 40 years, even 45, even 50, even 60, we still need our ovaries. But because you are tired, and I don't know where you have gone to be treated, I don't know. You say, "Remove my ovaries." The doctor is happy. The 2 ovaries are gone. They will never recreate again. They have been removed forever. We have made you a kind of a man because you can no longer produce the estrogen hormone, the progesterone hormone, which makes us to be really women. Yeah? You can no longer produce this. Now we have removed your ovaries. I wish you could see the right person, because a real gynecologist will only remove the ovaries when there is, there is that a required need to do that. Because we understand how precious they are. So the moment they are removed and you are happy and we let you go home, you start behaving now in a very funny way. We have removed your uterus, we have removed your ovaries, and you start now people may not understand you, because now you start having a sudden menopause. You get angry so often, mood swing, yeah, that's the right word. You have this kind of mood swings, yeah, you can sleep at night, you start sweating, you start complaining, you can complain for nothing, you just complain from morning to evening. You think people are not understanding you, but you are the one who something is not okay. You are psychologically affected. You are physically affected. Once you go to bed, you just want to remain there because the body is so tired, it's full of fatigue. You are no longer active the way you used to be. Yeah, you are no longer active. Unless we help you now to have your estrogen back. Yeah, so that it can help you now. The role it used, the role the ovary used to play, we can have kind of estrogen in your body to help you. Otherwise, you become very problematic wherever you are. So we have women who unfortunately have undergone that. A firm has got a solution for you. Yeah, we can help you. But again, you do not only need to come to us. What we want you to learn today is that understand why you are undergoing surgery and for what reason. And before you say yes, if it is not an emergency, try to get more information about it, or ask your doctor to explain to you in depth. And I believe if he is a true doctor, he or she will let you understand, so that you may reduce this. So many surgeries without a reason. Diseases that can just go away on their own when given time. Yeah, and the patient, after explaining to the patient, what could this be? Then we are able to understand the deeper meaning of this. Why am I going to get that? So join me in the next video where we learn more about our health. And I just want to thank all the people who have actually marketed me. Some have come to seek help. Some have subscribed, and some have liked my videos, shared, and commented. So please don't forget to share it widely. Let the people learn about this. Yeah, let the people know, because health is very expensive. Our health is very expensive, and you may not understand it until the time you become sick, or you find you have a close relative and you are there now up and down, looking for different doctors, different hospitals. That's when you understand this. But before it happens, let's take care of our health. So thank you so much for watching my YouTube, and may God bless you and keep you. And let us continue taking care of ourselves. Remember, always ask the doctor, why are you taking me to theater? I need to know. It is your right as a patient. Please Don't forget to subscribe. Thank you, and God bless you.